Hey there, YouTube. A lot of doctors, myself included, have been warning patients about the quick antigen test for COVID-19, that it doesn't have a great sensitivity. But I think that test might actually play a big role in how we manage this disease, particularly when we think about the 14-day quarantine. Let's take a closer look at that. So up here, I'm going to put a link to one of my previous videos where I talk about COVID testing and the differences between the types of tests, particularly the sensitivity. And in that test, I warn people about the rapid antigen test. The sensitivity is low, so there's a risk of false negatives. But listen, if I'm being honest, I've been struggling lately with how we test for COVID. I mean, yes, the PCR test is the best because it's the most sensitive, but it's frankly cumbersome to do. It's uncomfortable to get that test, and then it takes a few days to get it arranged, and then a couple more days to get the results back. I just feel like there's got to be a better way. So I've been doing a lot of thinking and reading about the rapid antigen test because it is really convenient. It's fast to do, and we get fast results. And I think that maybe this can be used in a really significant way in how we manage this disease in our population. And it all comes down to the following concept. Could there be a difference between someone being infected versus infectious? Now, what do I mean by that? So by infected, I mean you have the COVID-19 virus. And for the purpose of this, we'll define it as having a positive PCR test. That is the most sensitive test. So we'll say that someone is infected if they have a positive PCR test. By infectious, I mean contagious. So is someone contagious with the disease? Now, could there be a difference between the two? It's important to know who has this disease so that we can manage this in the population, but if we really drill down to what we really want to know, we really want to know if someone is contagious. That's why we're doing everything that we're doing, the social distancing, the mask wearing, the 14-day quarantine. It's just to get those people who are contagious away from the rest of the population so that we don't spread the disease. This is an area where I think this rapid antigen test might play a unique role. Let's look at a few patients as examples. All right, so the first patient is this poor guy here who clearly does not feel well. So he is infected and infectious. Now, this video is not going to deal with this guy. If you have symptoms like this, we know the right thing to do. So this video is not going to talk about people who are obviously symptomatic. Instead, we're going to talk about two people like this. So both of them look fine and they both feel fine. And let's assume for the purpose of this argument that both of them are infected with COVID-19. In other words, they have a positive PCR. Now, whether that means it's early in the illness, or they're one of these people who don't get symptoms, or perhaps they've had it and recovered but still have a positive PCR, whatever, let's just say that they have a positive COVID-19 PCR test. Now, what if there were differences between the two? So what if the person on the right was actually contagious? They have large amounts of the virus around and they're capable of spreading this to other people and therefore spreading the disease. But what if the person on the left is not contagious? They don't have enough of this virus in order to spread it around. Now, it seems to me that it would be important to tell the difference between these two people. One of them we need to isolate, but the other one perhaps not. But how do we tell the difference between the two? They both look fine, they both feel fine, and they both have a positive PCR test. This is where I think the antigen test might come into play here. So let's talk about the testing. And this all comes down to a concept called viral load. And viral load basically means how much of the virus you have in your system. And it stands to reason the more virus that you have, the more likely you are to be contagious. So the PCR test is the most sensitive test, and it tests for genetic material, and it only needs a small amount of genetic material to turn the test positive. So your viral load for a PCR test is somewhere around right here. The antigen test is less sensitive. It means you need more of the virus around in order to turn the test positive. So if a PCR test turns positive at this viral load, an antigen test will turn positive at this viral load. Now, could it be that the difference in this sensitivity, the difference in this viral load, means the difference between someone being contagious and someone not being contagious? Let's look at our patients again. So this patient here does have the virus, so the PCR test is positive, but does not have enough of the virus to turn the antigen test positive. Whereas this other patient here has enough of the virus around to turn both the PCR test and the antigen test positive. So how do we tell the difference between the two? Well, both look fine, both feel fine, both have a positive PCR, but one of them has a positive antigen test and one of them has a negative antigen test. Now, if this were true, if this difference in the sensitivity, this difference in the viral load means the difference between contagious and not contagious, there are huge implications to this. But I have to stop right here and I have to warn you because I am making a large leap in logic here and I recognize that I'm doing that. In order for this to work, the following has to be true. The difference between the sensitivity of these two has to actually biologically in a person correlate to whether someone is infectious or not. In other words, if this is where the PCR test turns positive and this is where the antigen test turns positive, we need whether or not someone to be contagious to be very close to this level here. If it's anywhere swinging farther away from that, then what we're talking about today is useless. The problem is I'm not smart enough to figure this out, which is probably why I'm waving my hands around instead of saying something intelligent. Regardless, I need somebody to figure this out here. But if we can establish that the antigen test is a good test for contagiousness, that has a ton of possibilities for us. Now, going forward, I'm going to mention the possibilities that we're talking about do not apply to this person here. If you're obviously sick and obviously symptomatic, that puts you in a different category. That's not who we're talking about. We're talking about people who look fine and feel fine. But I can think of a few different ways that this could be helpful. We all want to get back to school and back to sports and back to work. We could use this as a protocol to gauge whether someone's safe to continue to play sports or continue to go to school and things like that. But here's where I think the biggest benefit could be, and that's in the 14-day quarantine. So right now, if you have a high-risk exposure to COVID-19, you're going to quarantine for 14 days. That means 14 days out of school, out of work, out of athletics. It just has lots of social and economic implications. And the reason we do that is to see if you develop symptoms within these 14 days. Well, what if instead of waiting around to see if you get symptoms, we have a way to determine whether or not you're actually contagious and to do that quickly? The fact of the matter is right now, most of the patients that I put on 14-day quarantine never get symptoms and never get COVID. They're just sitting at home, away from school, away from work for 14 days. Well, if this antigen test turns out to be a good predictor of infectiousness or contagiousness, then perhaps we could get some kind of protocol in place to test frequently and then see if someone's able to go back to work. So basically you would test regularly, and if it's negative, you can go to work, and if it's positive, well, then you isolate. Now, in order for this to work, there has to be a few key things in place. First of all, the antigen test has to be good. Let's be honest here. When all of this started, the market was flooded with these cheap antigen tests that were so bad, so poorly sensitive, that they were basically useless. So it has to be a good, validated test. Secondly, it has to be readily available and it has to be cheap. We are going to be testing frequently and often, so I have to be able to get it to my patients easily, and it's got to be really inexpensive. But finally, and this is most important, we have to test frequently. Someone's viral load is not static. If you do have a virus, many times the viral load will start here, and as the virus progresses, it'll go up, and perhaps at one point hit a threshold at which you are contagious. That's what we want to test. For example, with the 14-day quarantine, how about something like this? If you get a high-risk exposure, we start a protocol where you get an antigen test every morning. You go in, you get your antigen test. If it's negative, you can go to work. If it's positive, all right, well, at that point, you need to isolate. But this gives us the advantage of, instead of just staying home for 14 days, giving us the opportunity to perhaps continue to work and go to school for all of that, or just maybe even at least part of that. So I think this has the potential to be helpful and at least get us back into some sort of normalcy when we're talking about going back to school or work or sports or things like that. I just need one of you guys out there to figure this thing out here for me, okay? As usual, you guys are amazing, and thank you so much for watching this video. If you thought it was helpful, please hit the like button. And also, if I could get you to consider subscribing, that way you don't miss out on any more videos of me waving my hands around like I know what I'm talking about. And listen, 2020 has been a pretty crazy year, so maybe we should all go around and assume that our brothers and sisters around us have had a rough time at it. So let's all be kind to each other and let's all take care of each other. We'll see you guys later.